Welcome back. You're on the Faculty Factory podcast, where we are a community of leaders sharing tools to build future leaders. So thanks for being here. I'm Kim Skorupski at UTMB, looking at Dr. Heather Whelan. Hi, Heather.
Hi, Kim. Thanks for having me. I'm excited to be here.
I'm so excited too. We've never had this conversation topic, so it's going to be a good one. Dr. Heather Whelan is a volunteer clinical professor at UCSF. She was previously a hospitalist at San Francisco VA Medical Center, and she's now the director of the Climate Ambassador Program at the UC Center for Climate, Health, and Equity. And Dr. Whelan is here thanks to our past guest and friend, Dr. Andrew Orr. You might remember it, Dr. Orr, ORR, with Dr. Whelan, I believe, talked about introverts. And so that was a really cool podcast, super fun. And he said, you know who you need to talk to. And this is how it happens. And so here's Dr. Whelan. She carved out some time to be with us today to talk about something we've never talked about before. Dr. Whelan, thank you again for being here. Heather, take it away.
Yeah, I'm excited to have the opportunity to talk with you and your audience about my work in climate change and health. Climate change is a huge health threat. It's been called the greatest health threat in the 21st century, and it affects all aspects of health. The areas that most people are more aware of and probably have been experiencing themselves are things like extreme heat, particularly in Texas. I'm sure you all are no stranger to that. Things like air pollution, and then also extreme precipitation events and flooding. I'd say there's some other health effects that folks are not as aware of. We've been having increased spread of vector-borne illnesses like mosquito and tick-borne illnesses. So, for example, areas of the United States that previously didn't have Lyme disease might now be seeing presentations of that that might be unfamiliar. Things like dengue, which previously was not in the United States, now we're seeing cases of that because of the warming trends. And then other things like disruptions to people's living environments and forced migration. They can't stay there anymore. So there are a whole range of health effects. And at the moment, historically, most healthcare trainees, whether they're medical students and residents or in other health professions like nursing, pharmacy, don't receive any education or training around climate change and health. And definitely, it's important to know about the health risks and what types of challenges your patients might be dealing with, and who's most at risk. But also, there are effects on the healthcare system. So we've seen disruptions to healthcare with hurricanes and other types of extreme weather events, and healthcare systems mostly are not prepared to deal with these and be resilient.
Yeah.
And then finally, the healthcare system has a huge impact in terms of greenhouse gas emissions. 8.5% of U.S. greenhouse gas emissions are from the healthcare sector, and that ranks as like the fifth largest country in the world in terms of emitters. And so there's lots of work to be done there as well.
Yeah. It's so interesting how medical school and other health programs, curricula get developed. I'm always fascinated by, well, who puts these curricula together? And we know we have accrediting bodies and certainly coming up with competencies in different fields, but I'm always fascinated to learn that, what do you mean in medical school you didn't learn anything about the lymphatic system? I recently broke my wrist playing pickleball. And no, it's not pickleball, so don't be one of those people listening that's going, oh, pickleball injuries. No, it was my fault. I was backpedaling. You never backpedal. You should scoot sideways, like a basketball shuffle, or run backwards. Anywho, my massage therapist, my acupuncturist talking to me about the lymph, all this lymph fluid making me swollen in my hand, and learning. I said, well, how come that my doctor didn't mention anything about that? They don't even talk about that. Then I asked my doctor, like, oh, we don't learn about that. I'll have to go research that. And I kind of thought, what do you mean you don't? There's a whole lymphatic system. What do you mean we don't learn about that in medical school? Or when events happen in the world of, say, COVID, and all of a sudden, anxiety, the rates of prevalence of anxiety and mental health becomes an issue that, geez, we don't even talk about that. We don't talk about that or train up for that. So I think there are imperatives that are calls to action where we have to think, well, gosh, why aren't we addressing this? Why aren't we hitting this right up front, or whatever, that I'm sure people can think of 100 examples of, like, yeah, how can we spend so much time looking at organic chemistry instead of things that have, direct application? So I appreciate your awareness of this has health implications. This is not voodoo. This is science. We all know about breathing in pollution will cause lung damage. How many times we've heard all the stories of black lung. I mean, this is kind of the duh. So I guess I won't get on a soapbox, but thank you for bringing it to our attention to it, Heather.
Yeah, and I think, it's interesting, like speaking of air pollution, we know that there are direct effects on the lungs, but people may not understand that there are also effects on the heart, or pregnant women who have a fetus. It affects their development, causes preterm births. For children, it can cause lasting damage to their lungs and lung development. It can travel to other organs like the brain and cause dementia, can cause kidney problems. So I think there are a lot of hidden effects that people aren't aware of, and may not have control over their exposure or not. If you live in a place where there's air pollution, it's hard to escape that. I think in terms of including it in medical education, climate change and health, I think there are a number of reasons that it's not happening. We're talking about, like, obviously this is a problem and we should address it. One of the problems is just that health training curricula are so crowded already. And so there's always a bit of a competition for space in the curriculum. And one of the other challenges is that most faculty do not feel competent to teach about climate change and health. It's not an area that they have expertise in, and we faculty do not like to be not experts. And so, and then there's just not a lot of resources being put into faculty development, or thinking about how to include this in the curriculum. One force that has been very helpful in terms of moving this forward has been medical students, who oftentimes are much more educated and expert about these topics. And in many cases at many medical schools have a lot of pull with curricular leadership, and so can go to curricular leadership and advocate for this, and have sometimes more success than faculty in requesting or demanding that it be included in the curriculum. And then the final thing I'll say is just that what we've discovered, because there are a lot of people working in this area, and there are some schools where they are starting to incorporate this into the curriculum, is that using an integrative model instead of like a separate elective course or separate lectures on climate change and health is to, talk about urban heat islands, which are areas where there's a lot more heat and pollution, in a lecture about maybe COPD or asthma, and just integrating it into the existing curriculum.
Yeah, drawing that thread throughout the entire curricular content. So making sure that every course, if you will, would have that, pull that thread forward. So how does AI, how does augmented intelligence interact or interface with this knowledge or this application or this diagnosis, treatment, cure, prevention? That kind of would be something to pull that through. So I can see pulling that same thread through what environmental toxins or could impact this organ system. I can see that just makes total sense to always remind people, oh, that's right. We're thinking in the context of climate. What is climate? And something you said earlier, Heather, reminded me of, you said no, instructors don't have this expertise, but guess who does? Our schools of public and population health, and our
Absolutely.
epidemiologists, and our global health experts, and our infectious diseases people who do look at vector-borne illnesses. There's a lot of expertise out there to cross-pollinate interdisciplinarily.
Yeah, and that's really a great point, Kim, because we're thinking just even in the health sector there, but you could think about the energy sector or transportation sector. All of these things affect climate change and affect health. And so one of the, I think, challenging and interesting things about the field of climate change and health is that it requires these cross-sectoral collaborations in order to address the issues.
We've covered the fact that this is obviously important. There's a ton of epidemiologic and all other kinds of data documenting the impact of climate change on health effects. What do we know? What's happening about it? Who's doing any work there in this
Yeah.
space?
Yeah. I mean, I think there are multiple organizations doing work. Public health organizations like the American Public Health Association is doing a lot of work in this area. There are, for example, there's a physician and healthcare advocacy organization called the Medical Society Consortium on Climate and Health that does a lot of advocacy for policy. Policies have huge impacts. If you think about, again, things like energy or transportation policy, housing policy, that has huge impacts on people's health. There are educational groups. For example, the Global Consortium on Climate and Health Education is out of the Columbia School of Public Health. And they have put together a multitude of free resources on climate that support people to do climate and health education. And so they have like small group sessions that are evidence-based and vetted by experts. They have slide decks. They also have started collaborating with other health professions, pharmacy, nursing, and so are providing resources for education in that domain. There are a lot of community organizations who are doing work on the ground within their own communities and then partnering with cities and regional governments, both in terms of funding, but also in terms of what we call adaptation and resilience sort of planning. So just like you're talking about with coastal flooding, what is the community going to do? How are they going to protect themselves? Big questions around, do you rebuild or is there a retreat plan? When does that happen? Over what period of time? How are people compensated or supported in that process? It's obviously, they talk about climate change and health as being a wicked problem, and it is a wicked problem. Like, it's a very complex problem. So there are many, many organizations in all different domains and sectors doing work in this area. And I think a lot of the challenge is funding and resources, obviously. I think educating the public. And then I think also just creating collaborations, because oftentimes people are working in silos and maybe repeating work. And if they can share resources or share data is oftentimes a challenge. Getting accurate data around things is a fruitful strategy.
And so on that note, in terms of collaborating, is there some central society, organization, conference where you can come together, or some shared repository of a list of who's doing what, so that we are avoiding the duplication and being better stewards of the scarce funds and resources that we have?
Yeah. Well, previously there was an Office of Climate Change and Health Equity in the federal government, which is not functioning anymore. A lot of those resources were saved and are now in other locations to be available for folks who need them or want them. There are some organizations. The National Academy of Medicine is, a very large organization, scientific organization that focuses on a variety of different issues, but they have taken up climate change and health as one of their biggest issues. And so they have a number of collaborations going nationwide in different domains, from healthcare sustainability and trying to make the healthcare system greener and reduce emissions, adaptation and resilience, and then just, addressing the health threats of climate change. So that's one big organization, which is, somewhat of a central place. There are a number of other organizations that are national, but I wouldn't say there's like one overarching organization, and that is part of the problem.
Yeah, it's so big, like you said. How do you have just one organization that deals with all the
Yeah.
climate change things? I met somebody yesterday she worked for an association, and she laughed. She's like, I hate have you ever heard there's an association of associations? But that's kind of like a catch-all. I'm like, oh, I've never heard of the association of
Yeah.
associations.
Yeah. Yeah. Like, for example, I this morning was on a call. There's a group called the Alliance for Heat Resilience and Health. And this group is a collection of people from different organizations doing advocacy and policy work who has come together to try to cohesively come up with plans about how do you address the health risks of extreme heat. So, working with cities, working with other levels of government, working with community organizations, and then they are trying to partner with other people doing work. But even like just in heat, today we were talking about reaching out to researchers who are doing research in extreme heat and thinking about, like, one, they're planning to do a pilot about how to respond to extreme heat within a city and thinking about all the different players in that city that you would need to coordinate with. So there's a lot of on the ground work happening with, and I'd say a lot of the people in these communities know one another because they work together on all sorts of things, but it's a little bit more grassroots
Yeah.
at a smaller level than a huge government organization or national
Yeah.
organization.
And that makes sense. So many things that we do, I love the saying, nothing about us without us. So a
Yeah.
lot of our science has to be local. Every if we're smart, we put on that lens of like, what does my community need? And your community can be defined broadly. What do my patients need? What do my learners need? What does my community need? What do my colleagues or my staff in my lab need? Yes. And to be informed by best practices nationally or
Absolutely.
internationally, that kind of freeway that has to be a conduit that we should be sharing those best practices. So it always makes sense to have your finger on the pulse locally, but having thinking forward. There's some saying like act
Yeah, think globally,
locally,
act
think yeah,
locally.
yeah, whatever.
Yeah, and that's true. And I think actually this is a really good point that you bring up, because while climate change, has many different effects on our environment and on the health, it's also very regional, right? I live in the Bay Area, and so extreme heat where I live, very close to San Francisco, is not as big an issue as it is in Texas. I mean, you can travel 20 miles inland and it is a huge issue. But actually, in this little microcosm, it's not as big an issue. However, wildfires and the smoke from wildfires are a much bigger issue in California than in some parts of the country. And so, and I think this is a challenge too in thinking about education, is you need to be focusing on the health issues that affect that local community, and you can't cover everything, right? Like, you can give an overview, but you really want to focus on the issues that are affecting the communities that you
Yeah.
serve.
And you're right, Dr. Whalen. It's just like science. And when we have a specific testable hypothesis, it can be very narrow. But what do? We do a literature review. What is known in the field? What
Yeah.
are the gaps in the field? The same
Yeah.
thing. If we want to focus on some specific pollutant in community XYZ impacting this population, something, very, very narrow, we're going to want to have the scope of the broader picture of what's happening in other locations in that specific pollutant or that specific subpopulation of people. And we want to have the awareness of other cousin conditions or diseases or cousin groups, because that might inform uh, what we do or don't do. So that curious mind to me is what I love about science, and I love about these kinds of big questions of having the lens to be able to both be very, very focused, but then to be able to sit back and broaden the scope to take in the information. So I love the work you're doing.
Yeah, absolutely. And I think you're right. Like, you can have a very local problem that you're dealing with, but find a best practice from elsewhere. So, for example, these are things I've even just seen on LinkedIn, where um, with the issue of extreme heat, if you're thinking globally in some neighborhoods that are very, very poor, there are examples of just amazing innovation of people making green roofs in the favelas in Rio de Janeiro, and it drops the temperature like 5 degrees, within their homes, which is huge in a place where you don't have access to air conditioning, and can really, save lives. And again, like these kind of low tech solutions are really helpful to understand because they don't cost a lot of money. And so you can think about how can those be deployed in other areas as well.
Smart. Dr. Whalen, what is happening? What do you do at the UC Center for Climate, Health, and Equity? Like, what happens there? If you'd like to share some of that
Yeah.
good news. And then, if you wouldn't mind, with, with ending with a couple pointers or ideas you might have for listeners of things they can do personally, or collectively, or the bigger the micro, the meso, the macro level. What, if you could leave us with some action items, I think that'd be really helpful.
Yeah, absolutely. So the UC Center for Climate, Health, and Equity was founded a couple of years ago by two really great leaders. Ariane Teherani is a PhD in medical education and also has a background in environmental science. And then Sherry Weiser is an internist and physician researcher in global health. And so they got together and, started this from the ground up and, really worked hard to get some funding. And so now they have different pillars. They focus on education, they focus on research, they focus on advocacy and policy, and so have a number of different programs going. They've started some fellowships in healthcare sustainability, partnering with sustainability offices within UC to provide opportunities for either faculty or trainees to do projects in healthcare sustainability and get more formal training. They have educational programs that they offer. The work that I've done with them is maybe about 2 years ago now. They decided to sponsor an educational project called the Climate Ambassador Project. And the idea was to recruit faculty and students from different health disciplines across UC to collaborate on an educational curricular project. So we had a competitive selection process and recruited a faculty member and student from pharmacy, nursing, public health, and medicine. And then we all worked together to develop some curricular resources. And so one of the main things that came out of this project was developing curricular roadmaps. And so basically using the evidence and using some agreed upon sort of competency domains, things like knowledge and analytics, public health, communication. And we developed these roadmaps that include topic areas and then learning objectives, but graded for different levels of learners and using Bloom's taxonomy with the idea that like these very concrete resources then could help medical educators who don't already have expertise in climate and health, but are interested and need a place to start. And we also developed along with these curricular roadmaps, some ready to go educational resources, slide decks and small group sessions and things that people can just pick up and use or adapt. We have a resource library that has evidence-based, high-quality resources for information if you're trying to research air pollution or heat or public health that we also are offering as a resource for people to use. So anyway, it took us a long time to develop these, but we finally developed them and they're available. We have a Google link where people can access them for free. And at this point, we're really trying to get people to use them to see how the implementation part goes, because that's actually been one of the biggest challenges with medical education is there are a lot of resources now, but actually getting them in the curriculum or using them on the ground has been a little bit more difficult.
Oh, yeah.
Yeah.
Thank you for doing that. I share your pain point around that. My Clifton strengths, number one, is input. So I'm a gatherer. I love to get all the stuff and put all the stuff, like the facultyfactory.org website is just chock full of resources that I think are so important, so cool. And
Yeah.
it's just too much. You
Yeah.
put all these repositories together, and like you said, Heather, who, now what? All that stuff's there, but do people click on it? Do people go there? Do people use it? How do they do it? How do they use it? Do they implement it? How can you afford to? It's all time and resources, and it's a lot. So I applaud you for compiling all this information. And you mentioned another vehicle to get this education as your podcast. So tell everybody about your podcast.
Yeah, thanks. So a couple of years ago, I I love podcasts and storytelling, and so I've always wanted to do a podcast. And I ended up connecting with a medical student in the UK, and starting a podcast called Climate Crossing. Um, and then the initial goal was really to focus on really talking to like healthcare professionals working in climate change and health about their experiences. Why are they doing this work? What does it mean to them? Because it seemed like that aspect of the emotional aspect was missing from a lot of the resources out there. It's evolved a bit, but we talk with different people working in the field, and could be clinicians, could be public health folks. But yeah, we're always looking for other people to interview. And I love doing it just because I get to ask the questions that I want to ask and learn. And so we're still working on trying to make it as useful as possible for a general audience. And so maybe including more information on particular health problems and climate change for folks who are doing clinical work.
Well, Heather, I still want to learn what you think we can all do.
Yes.
But while when you think about that, I do want to tell people that on the facultyfactory.org website on this episode, we will have a link to the UC Center for Climate, Health, and Equity. We will have a link to your podcast, Climate Crossing, and your email address, if people want to get in touch with you directly, is heather.whelan. So it's Heather, Heather Whelan, WHELAN at ucsf.edu. So I just want to put that plug in there for you. And Heather, what can we do?
Yeah, I mean, there are so many things we can do. And I think there's actually a climate advocate who's an oceanographer. Her name's Elizabeth Ayanna Johnson. And she has this Venn diagram of what is your passion, what are you good at, and what needs doing. And then like in the center of that Venn diagram is the action you should take. So, I think if you're an educator and you love education, you can pick a topic and just do a little bit of research around that topic. Maybe it's extreme heat or air pollution, and just sprinkle it into your conversations with trainees. You don't even have to do, a whole chalk talk, but just making people aware that this is impacting health and people's lives. There are some resources. The Global Consortium has a resource called the Climate Resources for Health Education, which has a lot of great resources for somebody who doesn't know a lot and wants to start working in this area and doing some education. I think the other thing we can do is just talk to patients. You don't even have to call it climate change. You can just say, have you experienced extreme heat or flooding or pollution? How is that affecting you in your life? And, we can really gather information about what is going on for them. Are they struggling with housing? Do they need an air filter at home? Right? Just like very practical things that will affect the quality of their lives and health. And I think they've done surveys that say that healthcare professionals are amongst the most trusted people to talk about climate change with the public. And so taking advantage of that opportunity to educate and to inquire about, how this is affecting people. And then I think the final thing we can do is simple things, vote. Or, if there are policies that you want to support, advocate, with your lawmakers for policies that protect health in the setting of climate change. And that could be an energy policy for renewables. It could be a transportation policy, for, cleaner vehicles. But yeah, there are a number of things that we can do.
Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.